advocates. My name is Rhonda Otteson with the Minnesota Coalition for the Homeless, and I want to introduce Mayor Kim Norton from Rochester. Welcome, Mayor Norton.
Great to be here.
Well, we're going to jump into a few questions here today during this regional interview. And can you talk a little bit about how the need for emergency shelter beds impacts you and your community?
Certainly, for the last 2 to 3 years, we've seen a drastic increase in the number of people that are homeless and needing shelter. We have had to kind of last minute throw together day centers and warming centers for the night. And, they're temporary, they're short-term fixes. And so without really a source for funding, it is cobbling together between the city and county some quick fixes in temporary facilities. And so we really need not only ongoing reliable support from the state, actually, because we know this is a growing problem. And we need to continue to build those partnerships with our nonprofits and our county so that we can have a strong system in place for our families. And again, that requires reliable funding sources, which we currently don't have.
Thank you for sharing that. Can you talk a little bit about, I know once COVID-19 hit in Rochester, you made some big changes. Can you talk just a little bit about those partnerships that have emerged? And I know I've heard it before, but I think the advocates listening would love to hear about some of the things that you've all done in Rochester to meet the need.
Yeah, I'd be happy to do that. When I first became mayor 2 years ago, we noted a growing number of individuals that were sleeping in skyways and didn't have anywhere to go. Through working with the county, we did a quick remodel of an open shop across the street from the government center and utilized that for a warming center at night. It was, at the beginning, there was enough room in it, but when COVID hit, we had to be very careful with distancing, and so we didn't have an outbreak, and there just simply wasn't enough room. So during the pandemic, the city of Rochester utilized some CARES funding and cobbled together resources in order to open up our civic center. So the Mayo Civic Center became the day and night center eventually. And so we housed, we've had hundreds of people go through and utilize the services. Once the pandemic started waning a little bit, the county was able to broaden the space because they had an opening next door. And so they were able to move the beds further apart and provide a safer environment. We, of course, had to have a mobile unit come out because we had a COVID outbreak among our homeless population and do some immunizations at the Civic Center. And again, the one thing we have found is that when you have a place for folks during the day, service providers, the county can get out there and our nonprofits can get out to that site and talk to people and offer help. When people are dispersed throughout the community and living in unsafe conditions or in conditions or in places where we don't know that they're at, we can't provide those services. So we have really learned that having a place for people to congregate during the day not only provides them the food they need, the safety they need, but it also allows that place for opportunity for resources, for chemical dependency help or job searching or any other services. And in fact, our county, through this partnership, has been able to house over 140 individuals this last year. They could find them, they could find out what their needs were, and they could help meet those needs in the community by finding affordable housing. So we've really learned a lot. We, again, now have a temporary day center that will, we've extended it, but at the end of September, that site will no longer be available. And our night center, along with the Dorothy Day House and Interfaith Hospitality, a few other opportunities in town, that too is in a temporary facility that will be used for something else in the next year or so. So we really are in need of some longer term solutions for people in our community that need our help and support.
Well, thank you so much for being such a strong advocate for the work that we're all trying to accomplish together. If you had one message for advocates across the state, what would you say to them?
The first thing that comes to mind and comes from the heart is thank you. Thank you for caring for people who really do need our help and support. And so keep up the good work, and let's see if we can't get some emergency funding. And my hope is also for some bonding so we can get a permanent solution. So thanks so much.
Yeah, thank you, Mayor Norton, and have a
Mhm.
great day.
Absolutely. Thanks.